Welcome to KAICIID's webinar. We will discuss and share experiences on how faith communities play a role in supporting mental health during current global pandemic. And without further ado, it is my honor to introduce today's moderator, Dr. Willard. Ashley, please, the word is yours.
Greetings. Just want to apologize in advance. We are not going to read the bios. We have an hour. We want to hear as much from our speakers as humanly possible. So you can look at the chat, and then you look at the chat and you'll be able to read their wonderful bios. Each one is capable of doing a wonderful job. I was raised by Southern parents. And so they often say, how you doing? How you doing? And I would ask religious leaders, how you doing? And they'd say, I'm okay. And being a psychoanalyst, I could look at them and realize that they were not okay. And so since the pandemic, I've been sharing with people that it's okay not to be okay. You're carrying a load and the weight of others. And in the United States of America, I told caregivers that we're dealing with a quadruple pandemic: COVID-19, systemic racism, violence, and partisan politics. And so anxiety and fear and stress are normal when we're faced with uncertainty and the unknown. And COVID-19 has significantly changed our lives, our routines. It's restricted our movement, and it's changed our coping mechanisms. So when the global pandemic began and impacted the world back in March 2020, the demand for mental health services increased noticeably. Communities around the world were faced with new realities, such as temporary unemployment, job losses, country lockdowns, social distancing, and a lack of physical contact with our family members and friends, our colleagues. We were restricted in our houses of worship, how we worship, and if we could worship together. And I just shared earlier, all of us seem to have earned PhDs in Zoom or WebEx or whatever your particular media is. So those challenges triggered mental health conditions, and they helped to increase the ones that were already existing in communities. And as you know, some communities have limited access to health services and mental health support. So according to the WHO survey, the pandemic has disrupted or halted critical mental health services in 93% of 130 countries worldwide. People from all faiths began seeking mental and emotional support. And here's where we come in, because faith and spiritual actors and leaders stood up in many ways, provided spiritual care and grief counseling, and became the frontline workers. However, we were overwhelmed by all the demands and all the challenges. So this webinar, we're going to discuss the role of spirituality and health, mental health, of challenged groups, and present examples of interfaith initiatives that supported different communities throughout this healing process. And so we're going to begin with our first speaker, a New York person, colleague, New Jersey person. We just met and didn't know we were fans of each other long distance. So without further ado, I'm going to ask Rabbi Naomi Kalish to, and I know I killed out her name, I apologize in advance, but please, if you would just give her a presentation and we'll ask some questions in between.
Thank you very much, Dr. Ashley. It's such a joy and pleasure and honor to be here with you, as well as the rest of the panelists, and I'm looking forward to a period of learning with all of you today. I'd like to start my comments by addressing the question of who is vulnerable. And let me just pull up my slides at this moment. We can ask ourselves, this is an important question for us to ask ourselves, because we can't develop a strategy for supporting people unless we have some conception of who we're trying to care for. And often we've been speaking of vulnerable people or vulnerable communities? Well, the word vulnerable literally means capable of being injured. And I think, as we know, the COVID-19 pandemic actually threatens everyone. So there's a certain universal or a global common threat to all of us. And yet, I think what our question is who is more vulnerable? And one way to answer that question is to ask ourselves, who has a predisposition to mental illness? By this, what I mean is that people who already have either a struggle with mental illness or a possible struggle from an illness perspective will be more vulnerable. So people who already have experiences with, let's say, anxiety or depression or other mental illnesses, people who are in categories that are more likely to be threatened, we should be paying attention to. I'll come back to this later, but this means we need to know who those people are, which of course means we also need to address issues of stigma and other barriers which might prevent us from knowing who those people are. The second way I'd encourage us to think about who is vulnerable is to think about who is socially vulnerable. So beyond the kind of, let's say, biological predisposition to mental illness, who is socially vulnerable? And here we can look at our social contexts, and I've responded very much from the perspective of the United States. The United States, it's very well documented that we have health disparities influenced by racial injustice, which have been very prevalent in general throughout history, but including through the pandemic and including through the intersection of mental health and the pandemic. People who are socially isolated. So in the United States, this includes the elderly, but it also may include other populations. I hear people in their 20s who live by themselves are socially isolated. People in the LGBT community who also have a social predisposition to mental illness are going to have that exacerbated. People living in abusive relationships who are now isolating in the homes with their abusers. People lacking access to technology, which we have become so reliant on as the form of connection. But what I'd like to do is ask us, are religious leaders a vulnerable group? We might think that religious leaders are not a vulnerable group because, after all, religious leaders and religious actors, people who consider themselves to be religious people, have faith and spirituality and community. And so we may say they are not vulnerable people. But like healthcare workers, who also we might say healthcare workers aren't at risk, they have great access to healthcare, which so many people don't. And yet, perhaps ironically, perhaps not ironically, religious leaders are very vulnerable, very capable of being injured, both physically as well as emotionally and psychologically by the intensity of the pandemic. So what we have during a situation of a disaster, which I have learned from Dr. Ashley's well-read and well-regarded book on disaster chaplaincy, is that we have a breakdown in the caregiver care receiver roles. Now, of course, these are false role distinction anyway, because we're always human. However, we are experiencing the crisis of the pandemic at the same time on a personal level as on a professional level. So for us who are religious leaders, we are trying to both care and tend to, at the same time that we're trying to manage the crisis. And I would add to this a few factors that are distinctive for the religious leader and the religious care receiver. Religious leaders, as Reverend Ashley mentioned in the introduction, we have had to redesign our mechanisms of care. Our entire societies across the globe have had to reimagine and redevelop mechanisms for loss. We've not only experienced the loss of loved ones, the losses through illness, losses through the disruption of daily life, loss of our regular joyful events, we've also experienced the loss of our grieving mechanisms themselves. So we've had to redevelop those. And you may have noticed sometimes in these new innovations, some people say, oh, a Zoom prayer service, that was wonderful. That was so great. It felt so good. It did it for me. And then you talk to other people and they say, that was terrible. That didn't do it at all. And those people feel so broken. And so when we ask ourselves, what is the experience not only of that, that person we're trying to care for, what is the experience of the religious leader in that case? And often it becomes a crisis for the faith leader, also a crisis of how can I be effective? How can I fulfill my purpose, my call, my desire to be helpful? And so this can lead to a feeling of burnout among religious leaders. So in addition to caring for people during crisis, caring for themselves or their family members, religious leaders also are dealing with the feelings that come up of their own worthiness within the crisis. I have not been paying attention to the time. Dr. Ashley, am I doing okay? A few more minutes?
A few more minutes.
Okay. So what do religious leaders need? Religious leaders need both mental health care, they need to be the recipients of care, and they also need mental health training. So this means that when we think about providing, developing systems of care, and as we've just heard, there's been a decrease in mental health services, we also need to think about providing those cares to religious leaders and religious actors, and we need to make those contexts for care ones in which they will feel comfortable participating. Sometimes that will be with other clergy or other religious leaders, and sometimes it might not be. Sometimes it might be with their own faith group, and sometimes not. The second is we need to better equip religious leaders to deal with the mental health challenges. This bottom picture with Zoom is me in my class this past year. And I won't read through all of this, but one needs to develop training objectives to help equip religious leaders to recognize signs of mental distress and know the resources for responding. This will better serve their communities, as well as this will better serve them, because when when religious leaders understand how to be effective and how to partner with the mental health fields, they will also feel much better about their own participation. Thank you.
Thank you. Thank you. We appreciate your presentation, appreciate your wisdom and your knowledge. I did have a question or two, at least ask one. So in your own experience, I know that you work at the seminary, I know that you're involved in the New York metropolitan area. What are clergy saying to you? What are religious leaders saying to you?
One question that people are asking is, we now have this new expression called telechaplaincy or telecare, telepastoral care, and providing pastoral care and support by telephone or video conference. And the question is it effective? It's a really great question because we don't have research to yet and data to support it. But what we are experiencing anecdotally is that, yes, it's very effective. Sometimes it's even more effective. A meaningful phone call, a regular phone call can make a tremendous difference for a person to feel connected and supported, and that there's somebody out there who cares about them. I'd say the same is true of clergy, that they too want to receive those phone calls.
Yeah. Yes, I totally agree. Well, thank you. Well, we're going to come back to you later on. We're going to all kind of interact together. Let's hear our other colleagues. And so We Win is going to speak to us next. And again, you can read her information in the chat. And she and I have been texting and emailing back and forth. She said, just call me We Win. So We Win, here you go.
Okay. Yeah, thank you so much, Dr. Ashley. Let me share my PowerPoint. Okay, can you see it?
Yes.
First of all, I would like to thank you very much to KAICIID for giving me a chance to share my project entitled Strengthening the Interfaith Women Solidarity Movement to Overcome the COVID-19 Pandemic. Basically, this project based on our internal survey, online survey, it found that more than 75% of our members who are women from different religion and ethnic backgrounds are facing mental health problem. So then my friend and I started to implement several activities. As we are now that actually in Indonesia, poor people is more than 24 million, yeah. So it becomes the hardest time if we only rely on the government to solve the problems. And beside the economy and social problem people are facing during the pandemic, their physical, mental, and spiritual health also they are facing the problem as well. Therefore, this project actually we try to implement 4 programs. The first one is providing assistance for for basic needs to vulnerable people, including elderly and people with disability, and economic empowerment, psychology or mental support, and spiritual resilience support. In this time, I will present only psychology support and mental health support and spiritual resilience support. So for this psychology mental health support, we try to increase knowledge and skill of society in facing the mental problems due to the pandemic, and also to support and to strengthen mental health of interfaith women. We had 6 activities. The first one is we try to equip the facilitator by conducting 2 times training of facilitator of mental health support group. There were 12 Sri Kandi Lintas Iman is the interfaith women community that I founded after my fellowship in KAICIID. And then the second one is online mental health support forum via WhatsApp group. So we had 4 groups of mental health support. Each group actually consists of 10 participants and 2 facilitators. They meet online every 2 weeks within 3 months, yeah, from June to August 2020. And then also we had online seminars like 4 times. It's amazing that people actually they let's say respect of our program, especially online seminars. These seminars what participant more than 400, and also the viewers in our Facebook and YouTube also more than 12,000 people who reach our seminars online. Also, we try to develop serial of short videos on practical guidance to manage the emotion. So we produce 2 short videos, 6 minutes, yeah, and this is also published in our Facebook, Instagram, and YouTube. And the last one is we publish ebook entitled "The Power Struggle of Interfaith Women in Facing the Pandemic." So we try to share the experience of women in the history and also now how to face the pandemic. And this book also contain of the 14 writers from various religions and local beliefs, including Islam, Christian, Catholic, Hindu, Buddha, and Confucianism, and also local beliefs here in Yogyakarta. We already held a book launching in the September 21st. At the time it's the International Tolerance Day, yeah. September 21st is International Tolerance Day. So we try to publish this book, how to to show the people that the pandemic is actually not happen this time, but we had it in different ways, and people, especially women, they play very important role in facing and in especially how to deal with the mental health issues. And the last one, we also try to support we call the spiritual resilience. I don't know whether Dr. Ashley agree with this what we call term, but in Indonesia we call spiritual resilience support. So beside the mental health, we also, because Indonesia is people in Indonesia is religious, yeah. So we try to connect this a spiritual problem to how to strengthen the spiritual resilience that people already have. We also in this program we try to increase knowledge and skills of society in taking care of spiritual health, and also to invite people increasing their spiritual resilience. We had 3 activities, including online seminars and infographics. This part of our campaign, and also the serial of short videos on strengthening and the spiritual resilience, including 1-minute campaign videos. Yeah, we promote that God still with us, something that because a lot of question about where is God in this time, in the pandemic time. That's all I can say. Thank you very much, Dr. Ashley.
Well, thank you. Thank you for a wonderful presentation. And don't go away. Let's chat. So the work that you did looks amazing, but I know that it's not as easy as it may look in 3 or 4 slides. So what were some of the challenges that you faced?
Okay, actually we had several challenges. The first one is this is for us, for our community. This is the first time dealing with online meeting, yeah, during the outbreak. Actually, the challenge is how to cope with anxiety and uncertainty while try to manage the programs. Yeah. The second challenge, actually, the online coordination among team is different. Yeah, so it needs an adaptation, and it's not always easy for us. And another challenge also, it is not always easy to communicate via WhatsApp group or mental health support program. One of my friends, she's the referent, yeah, she had a long of experience related to mental health support. She said that that was the first time for her to manage mental health support through WhatsApp group, and it wasn't easy, but it helps, yeah. And also another challenge, actually, how to create safe space for all members of group in mental health support program. It's also not easy because some of us sometimes it is not always what we call safe for some of us to write down in the WhatsApp group their mental health problem. So and then the last challenge is actually when we talk about the online thing, the internet connection problem is it's also faced. Yeah, we are facing about the internet connection problem because in Indonesia, some place they have good connection, but another place they have very low internet connection. Thank you.
Thank you. One of the things that I've discovered, and this may or may not be the case with you, that in the work that we're doing for others, it also touched us. Are there ways in which this work has touched you? Can you talk about that?
Yeah. Sorry, could you please repeat the question?
In doing this work, and it was wonderful work, and the way that you reached out to the women and the differences that you made are just amazing. But I was just wondering, as you were doing that work, how did it impact you? How did it touch you?
Oh, yeah. The first one is I myself, my background is not from psychology, but through this program, actually, I learned a lot about how actually we have to balance between physical and psychological health. This should be balanced, especially in this crisis, yeah, and especially for women, as you are aware that we had a lot of uh, what responsibility, yeah, and now during the pandemic, our responsibility is not about domestic affairs, but also we are we are facing with the education for our children, yeah, and also how to cope with the because this pandemic also decrease our income. So how to manage the the financial thing? Yeah, yeah. Thank you.
Thank you. No, everyone I've spoken with said homeschooling has been a challenge. Even people that are licensed teachers who do this for a living said it's one thing to teach somebody else's kids, but to have to teach my own kids every day, like, if I didn't need mental health before, I need it now, because whoa. And so it's funny in that we've had a new appreciation for people that teach our children, because we realize like, oh my, this is what you do every day for a living. Oh my God. God bless you. Well,
Yes.
thank you for the work that you do. And then again, hang in, because we're gonna interact with each other in just a little bit. And so Rince Agal,
Thank you, Dr. Ras.
thank you, is our third speaker. And he's going to share with us the work that he's been doing in the Philippines. So go for it.
Thank you very much, Dr. Ashley. Let me just share my screen so everyone can see my presentation. I hope you can see my presentation now. So I'll begin my discussion on what I believe is the role of religious communities in promoting mental health during this pandemic by sharing some of the work that we have done here in the Philippines. Of course, we all know that faith leaders play an important role in also promoting and supporting the mental health of their congregations. And our faith communities are actually are in a vital position to also promote, support mental health, and create that safe space for all of us, for all those, especially those who are vulnerable, as mentioned in the earlier presentations. Um, what I would like to share with you is the model that we used here in the Philippines in order to provide mental health and psychosocial support services to different religious communities. This was organized by our movement, Religions for Peace Philippines, and we partnered with various religious communities and faith-based organizations. So the background of this project is that more than a decade ago, the southern part of the Philippines, the central Mindanao region, was affected by decades long of armed conflicts. So this was rooted in many different issues. But for so long, it has been a battle also between religions, between Christians and Muslims. So when Religions for Peace Philippines came into the region to see how we can contribute towards the peace process, we saw that healing is an important and an essential part of dialogue, okay, towards peace. And we realized that healing is not just essential, it's also a precondition towards dialogue, okay, towards lasting peace. So bringing our expertise, I'm a clinical psychologist by profession, we saw the need to heal the trauma from the armed conflicts in order to allow the people in the region to engage towards dialogue for lasting peace. So that's when our project, Counseling for Peace, was conceptualized. So at first, our idea was to bring women together, similar to the work that WIWIN is doing in Indonesia, bringing together women to support other women. Because in the Filipino culture, mothers particularly are the frontliners in their families. So we thought we would equip these women with the necessary skills on psychosocial support, but we saw that they were also wounded. And the same way that the young people there are affected by the armed conflicts, so we now started to provide the needed psychosocial services to the women and the youth from this region. The model that we used, which we ran for several years from 2008 to 2013, included several phases, particularly a response phase wherein we responded to the psychosocial needs of the community, especially after the war, the armed conflicts has ended. This was followed by psychosocial rehabilitation. So apart from counseling and psychotherapy, we also created group therapy. We created spiritual groups for support. And then we also work towards rehabilitation through vocational and economic means by helping them develop livelihoods, because we saw that psychosocial support is also something connected and intersectional with other needs. The third phase of this was resilience building. So this is when we created support networks. So women leaders, women in the community, we created them a women's network where they can provide support to one another. We also created a youth network, which is an important source for peer support. And the fourth and last component of this was capacity building. So Rabbi Naomi mentioned a while ago the need for religious leaders to be trained in mental health. So this is one of the things that we did. So we trained religious leaders, we trained religious communities on how they could handle and provide mental health and psychosocial support. We trained communities to create crisis response and crisis mitigation mechanisms. And we created also a referral mechanism through the trainings that we did. When we saw that this program was effective in bringing together religious communities, we are proud that our movement and this activity and project is one of the few organizations that was able to put at that time both Christians and Muslims under the same roof, working together for peace. Because at that time, Christians were afraid of Muslims, Muslims are afraid of Christians. But during the project, they were able to see how they can help one another. And even, we had trained Muslims providing psychosocial support to Christians and vice versa. And we brought them together working towards peace. So when we saw that was effective, and the Philippines, is one of the countries affected by many typhoons, deadly typhoons, we saw the need to replicate this now to respond to communities affected by typhoons. So particularly two of the worst in the past decade, Typhoon Sendong, which affected also southern part of the Philippines and Mindanao, and Typhoon Yolanda, which affected the central part, which is the Visayas region, and killed more than 10,000 individuals because of the typhoon. So we saw also the need now to bring this model of psychosocial support, working with religious communities and faith leaders to support those affected by the typhoon. So at this point, because of the pandemic, we have also saw the need to move and use this model to help communities affected by this pandemic. At this point, what we're doing is more on the individual level, because we can bring together groups and communities. So we have been providing psychosocial support services to individuals, and we're now planning to provide training on mental health and psychosocial support to their communities within this year. So it's been in the pipeline. Apart from this work, I'd also like to share something that I have been doing personally. This one is a project actually of our Archdiocese, okay, the Roman Catholic Archdiocese of Manila. This is a project that we have been doing
Did he freeze or did I freeze?
I think it's from his side.
Okay.
Hello.
Oh,
Sorry, I
you're
think I
back.
lost.
Okay.
Yeah, sorry.
Okay. It's not unusual to have Zoom challenges, so this is one of them, but we're good on time, so we can. And this is an amazing, all of you have presented some amazing work and amazing projects, so we are all better for just having listened to each other.
Bye.
Are you back?
Oh, there.
There he is.
Sorry.
Okay. That's
Yeah.
okay.
Yeah. Okay. We've been having problems in the internet. Anyway, so what I was saying is that oh my god, no. Okay, sorry.
Here you are. Okay.
Yeah, to bring mental health information. So the radio station has this weekly program where we now share information to the congregation and how they can support the frontliners' mental health. Recently, I talked about how we can support children's emotions and also build resilience. So it's a great way to share this information that they can use. Relying on the resources that we have. And lastly, I'd like to talk about what we fake leaders particularly can do to help mental and promote mental health. So one is educating the community and congregations. Again, this can be done through training programs and capacity building programs. I just echo what Rabbi Naomi mentioned a while ago about religious leaders needing training, and she did give a lot of examples on what areas we really need to be trained on. It's important for us to create the safe spaces for community conversations and even support groups, similar to what Wiwin was able to do in Indonesia, that focuses on addressing these different mental health issues.
Well, he was about to wrap up, so maybe we can all come back together, the four of us, and kind of have a dialogue among ourselves and kind of chat with each other. And as he comes back on, we'll let him finish up. So can the four of us come on screen together? There we are. Okay. And so again, oh, there he is. Are you back? Nope, still frozen. Okay. One of the challenges of doing this globally is that internet connections are not the same all over. And again, I was sharing this morning, I was terrified that my connection would be bad because we had this major snowstorm. We had power outages throughout our state. So this is kind of expected, right? We've all learned to deal with the ups and downs of internet and Zoom and everything else that goes with it. So you're back. When you want to finish up your presentation?
Sorry
Sure,
about
I'm
that
sorry.
again. Yeah. Well, I was on the last few parts anyway. So again, it's linking individuals to professionals or organizations, or again, better yet, if we can create this support programs within our local faith communities. And again, lastly, promoting acceptance and understanding of mental health issues. I think coming from faith leaders, this would really be an important statement. Just my last point, and I'd like to emphasize this, as we also highlight the connection between religion. Sorry, I think my slide is not on the screen. As we bring together the connection between religion and psychology or mental health, let us remember to be careful also not to psychologize what is spiritual and not to spiritualize what is psychological. So again, thank you very much, and peace be upon you all.
Thank you. And we're glad that you were able to fight through and to be able to finish up. So thank you. Thank you
Dr.
very
Ashley.
much. So there's four of us here, and let's talk to each other. This is unscripted. We're just going to go for colleagues having a conversation. And I really appreciate the part that you talked about in terms of not to make psychology was not psychology, not to make spirituality was not, because there's a danger in that. And I know, and I've been sharing with colleagues, don't pathologize normal reactions to a pandemic. It's too early to bring out the pathology yet. Okay, these are normal reactions. I know people have talked about they're not depressed, but they feel like they're walking through quicksand. It takes longer to do common tasks. I know in the seminary, we've been sharing with professors, lighten up a little bit. We know the due date is this. However, realize that people are dealing with daily challenges, family and personal and professional. And I think what you didn't say, but you kind of did say indirectly, is that for many of us, we become prophets, if you will. And I know that has different meaning in different faith traditions. So let's say we've had to become advocates, and that in doing our work, we've had to advocate for others. And I don't know about you, but there were probably surprises in your work. So let me just start with that. What were the surprises? What surprised you or caught you off guard?
Well, I have a response to this, which also picks up on this quote, Dr. Renswich, that you concluded your comments. So I teach and supervise internships, which place religious leaders and also sometimes lay leaders, religious actors in what we call clinical settings with healthcare workers and other settings. And we shifted it all to online learning and what we call telecare. And we experienced a surprise and even a challenge, which was that when we said that we help religious, these chaplains are providing emotional and spiritual care, some of the mental health professionals and some of the social workers had a concern about our interns providing emotional care because they understood emotional care from a clinical perspective. And they said, how are you qualified to provide emotional care? They meant mental illness care. And so we realized that we needed to refine the language. And so this quote that you concluded your talk is so wonderful, because I think we really have to do that work ahead of time to talk about who is qualified for what. And also on a certain level, empathy, grief, like we're all qualified in a general way to be responding. But once we have we need a specialization to deal with complex situations, and we should be respecting that in one another.
Thank you. That's a great response. And as you were saying that, I was smiling because I've been arguing with my group therapy colleagues that religious leaders provide group therapy every weekend. So some others, what surprised you? What caught you off guard during this period?
If I may answer that, one thing I found surprising was that people really held on to their faith even during these trying times. I remember asking one of the people I were supporting, why they still believed in God and why they had strong faith, because during my session with them, they've been talking a lot about their faith saving them from all of this tragedy, and I was surprised to see that. And one thing that they answered was that it's already hard enough for us going through this with faith intact. What if we didn't have faith in us? How would we handle this? So for me, it was very surprising. It caught me off guard. I wasn't ready for that. I was ready to answer questions, challenges about where is God in all of these things. But hearing it from them that they still have faith, for me, that is something surprising, but in a good way. It touched me also. That for me is my answer.
Good, thanks.
Yeah. Okay. Yeah. One of the surprise for this program is actually there are a couple of our seminar participants of our seminars who actually facing a very bad mental health problem. So when they talk in the Zoom, they are while talking, they're also crying, and then after that, we try to communicate personally, and actually they need what we call further help from us. So we recommend them to consult with the professional. Yeah, because we are not professional, like Rabbi Naomi said. So we try to recommend them to and then connect them with one of the NGO focused on mental health problem, including actually some of the problem is not only mental health but also domestic violence. Yeah, because according to the survey in my country, the domestic violence during the pandemic is increased. Yeah, thank you.
And thank you very much. And in the same way, in the United States, I was told by our Drug Enforcement Agency regional person that alcohol sales went up at least 74%, if not more, and drug sales, legal and illegal, went up also tremendously. And so people have done, self-medication and so forth, and dealing with this. And yesterday I was on a Zoom with some clinical colleagues last night, actually, and as we were wrapping up, I was asked by one of the leaders, Will, you're doing this work, you're pastor, psychoanalyst, you're doing webinars and so forth, and how is all this impacting you, how do you find support? how are you getting through this? And so I thought about, you know, every one of us on this panel, we're caregivers, but we're also going through it as well, personally. And so I'm throwing it out to you, and I'll answer the question as well. How are you finding support? Where's your strength?
Happy to jump in first to answer this. I wanted to give one answer that kind of also addresses your last question, which is, as the others were talking, I was reminded during the pandemic, both my husband and I finished our dissertations and defended our dissertations on Zoom, and both became, earned our PhDs. And it was an experience of, thank you, of transformation and kind of unexpected joy. And I think what really amazed me was that through this method, we could feel like we could experience this change, but it wasn't only external, it was also internal. And so that was just a real testament to me that joy is possible during this really difficult time. And so I just say, like, how am I getting support? Like, you know, just being able to connect in whatever way is possible with friends, with colleagues, with families, you know, like the Zoom birthday parties and Zoom holidays. It's like a determination that it just must be good enough. It's not first choice, but it must be good enough.
I've been quoting Winnicott left and right. Good enough, exactly. And congratulations to both you and your husband on earning your PhDs.
Thank you.
So, how did you get support? How did you get through it? I know for me, to what you're saying, Rabbi, it was family, and it was, like you're saying, Zoom. We had Zoom family reunions. We've connected with friends, either telephone and Zoom, and we have an 11-pound Shih Tzu, 4 years old, and so she's been kind of an emotional support animal. It's an emotional support dog, and we said that we're actually her emotional support humans. So she keeps it very basic. Play with me, feed me, walk me. Life is great.
If I can also just add in that, I share the same coping and the same source of support, which is from family, friends. You also have a pet here, dogs that have also been a great source of joy. And also with the different, since, you know, we work in an interreligious organization, friends from different faith communities have also been a great source of support. Hearing their own stories of resilience, their stories of recovery, and how they're dealing with all of this was a great source of support as well.
Yeah, for me, the greatest support is actually my family, because before pandemic, two of my children, they far from my home. They live in Islamic boarding school, far away, like 5 hours by train. But when this pandemic, so all of my children home, so apart from them, but also from them is not always easy, because yeah, the committee or the, you know, organizer also they are facing the same problem in terms of mental health. So we try to communicate intensively, yeah, through WhatsApp and also Zoom, to support each other. So because we believe women support women. Yeah.
Good. Thank you. So I'm going to ask each of you to make a closing statement or answer a question I was supposed to ask and didn't ask, or give us a final thought through your lens. Anyone can jump in first.
I'll jump in first.
Okay.
So the training program I teach has students participate in what's called, and clergy and religious actors, participate in supervision, by which we mean that both their work is supervised, but also that they have someone to talk about what comes up for them in the experience, both emotionally as well as how they're balancing their personal and professional life. So in a sense, it draws on therapy and therapeutic methods. And as a closing comment, I'll just add again to this last question, that part of how I cope is by also making sure that I tend to my own emotional and spiritual needs. And so in addition to the work I do, and in addition to the family and friends, I also meet with someone who her qualifications are, she's a psychotherapist and she's an Episcopal priest. And I'm able to talk with her about the combination of personal and professional. And I just really wish that everybody has a way to engage both of those.
Thank you. That's very helpful. I'm glad you shared that. I had taken a course at Princeton Theological Seminary, and at that particular time, the professor had just retired as a pastor of Fifth Avenue Presbyterian Church, and he had said that all clergy need three things. He says we need a voice coach, so we use our voice properly. He said that we need a mentor that can cheer us and also kick us in the butt when necessary. He says, and we need a therapist. That the work that we do is heartbreaking. We need a place and a space where we can sit down on somebody's couch or comfortable chair and talk about it, and not dump it all on our family. And someone that's, as you said, that's trained to kind of push us, prod us, agitate, hold us, comfort us, and all the above. So yes, I'm glad that you did bring that up, because it's very important for religious leaders, religious actors, to be in a supervisory, therapeutic, whichever term makes you comfortable, but a relationship where you can talk about the challenges that you face, and even more so right now. Thank you.
I think I'll go second, like what we used in the previous questions. I think my last and closing statement would be that let us be reminded that while we are physically distanced, we are more and more connected now all over the world. You know, we do a lot of Zoom meetings. All of our connections are online. It has opened great opportunities for us to communicate. So I hope that we can use that as a way also to support one another, whether it be psychological, spiritual, or intersection of these two, which are very important for all of us. Thank you.
Thank you. We win. Bring us home.
Yeah, I'm sorry. Yeah, I just want to share the lesson that I've learned from my project. The first one is actually there is always what we call hikmah. So hikmah in Arabic, what's in English? So good thing, yeah, in that using online platform, yeah, in this project actually let us reach a wider participant or wider audience around Indonesia, even abroad, because some of our audience also not only come from Indonesia. And also I've learned that from the peer group of mental health support, we learn on how to become a good reader and a good listener. Yeah, that's my last sentence.
Well, thank you. And I just want to make sure that we do mention that I think it's international, but at least in the United States, there is a process by which we do train clergy and lay leaders to be good listeners. And Rabbi, you want to say just a little bit about that process? I know we call it clinical pastoral education, CPE, and seminarians go, but it's wonderful.
So the majority of people studying for religious leadership in the United States are required by their either faith group or by their seminary to take a supervised internship in pastoral caregiving. And pastoral caregiving is exactly what we're talking about right now, which is being attentive to the emotional and spiritual experiences, and also knowing how to make referral, developing self-awareness, and cultivating practices for one's own wellness. And so I would be happy if anybody has questions to be contacted, because this is a field I work in, and it is largely based in the United States, but does have also international presence as a model for education. So thank you for the opportunity to just make it that mention that there is an educational model out there that also can be modified for one's own cultural context.
Great, thank you. So some of our, oh good, you're gonna say some of our clinical colleagues, we are trained, we do get some training. It may not be exactly the same as getting a PhD or master's in social work, but we do have some training and appreciation. And I would add that for many of us, that we are the triage center, because we see people on a regular basis as religious leaders. And so be it Saturday, Friday, Sunday, whenever during the weekend or during the week that we see people, we as religious leaders get to recognize, like, oh, that person doesn't look quite right. They're not quite themselves today. Something's going on. So I may not know all the clinical terms, but I know that the eyeball test says something's going on. And so we can say, you know, let's talk after service, or let's talk during the week, or make an appointment, and so we can have this conversation. So I think that we as religious leaders, religious actors, play an important role. And it's always been my contention that we all have to play nice in the sandbox together. That particularly in America post 9/11, Hurricane Sandy, and now dealing with this pandemic, that we do need the clinical folks, which we are, but we also need the religious leaders so we can work together as we go about trying to get the vaccine to people, as we go about testing, et cetera. Again, we all need to work together. And your programs have, and your projects have shown the value of putting together the social, the psychological, the mental, and the spiritual, and how they all come together because we deal with whole people. And sometimes we're asked to bring, you know, parts of people. No, we deal with whole people. We're whole people. And so I think that this project, this webinar has been a wonderful avenue to begin a conversation. I don't think this is the last word. I'm sure that may not be us, but others will be having these kind of conversations. I hope I'm wrong, but just from what I've seen, I think that we're going to go into a global depression. If we're not already there, we're going to get there. Because I think that when people return to their houses of worship and realize it's not the same, it's going to really hit people in ways it hasn't fully hit them yet. When they start going back to offices and going back to trying to create the new normal, whatever that may be, I think it's going to really hit people that life has changed. There's been a shift. There's been a paradigm shift, or a number of paradigm shifts. And oh my God, what do I do with that? So I think that as religious leaders, as clinicians, as educators, we're going to be really busy. So rest up as you can, because I think, as you know, it's challenging now. I think it's only going to get more so. So I thank each of you for taking the time to be part of this conversation. I appreciate the work that you're doing. We celebrate the work that you're doing. And again, you know, congratulations, Rabbi, on getting your PhD and defending online. I cannot imagine what that must have been like. But again, you made it through, and you did it. And we win. Thank you for the wonderful work that you've been doing with women. And it's a blessing, just a blessing. And Christian, thank you for what you've done and working with the Catholic Church and with others, and just been amazing. So I think we're done. We'll turn it back to our host.
Thank you, Dr. Ashley. Thank you, Rabbi Naomi. Thank you, Mr. Gao, and thank you, Irene. It was really great to start this discussion. And as Dr. Ashley mentioned, it's only a start. And thank you for joining us. Thank you for presenting the amazing work you have done so far. And yeah, I wish you all the best in further endeavors in this direction, and we stay in touch.
Sounds good. Blessings.
Thank you so much. Thank you, Dr. Ashley. Thank you,
Thank
Anya.
you.